Well, good morning, everyone. Welcome again to another live this morning. Hope you're having a great start to your day. And we'll wait a moment or two before we let you know how much we appreciate you guys. Wendy, you're number one on the hit parade this morning. Good morning to you. And Ann, how are ya? Thanks for coming on, guys. Mike from Norland. Our regulars, we appreciate it. Ann, good morning. Another Ann this morning. Two Anns. And who's next? Zien, bonjour. Zien and Jean. Kathy, how are ya? Cleveland. First time I've seen that, Cleveland. Kevin, traveling in New Brunswick. Good morning, Kevin. Rita. Marl. Nice to have you on, Marl. Marl. Georgie, Halifax, Nova Scotia. Deed. And you know what, guys? My scroll has slowed down to a crawl. Donna. And Mary. Nice to have you on this morning. And Levi. Good morning. You know what we're going to talk about today? Pain. I may be a big pain. Donna, how are you? Zian, another Zian. Bonjour. We appreciate you guys. And let's see. Nicole, good morning. Julie, good morning. 2-day fast, she said. Good for you, Julie. Michelle, how are you? And a couple of more and we'll get going here. Veronica, good morning, Veronica. Thank you for coming on. Andrea, from Nouveau-Brunswick, and I'm assuming Jerry is there, but maybe not. But there's another Jerry who just said hello. There's 3 Jerrys, because Jerry. Bev, good morning. And good morning to all the Jerrys this morning. Okay, 2 more and then we're going. We appreciate it. Thanks so much. Connie, good morning, Connie. How are you? And some new names that I haven't seen in a bit. Rose and Deb from Timmins. Good morning. Okay, here we go. You know what we're going to talk about? Rehamar. And that's a new name I haven't seen before. How are you? Rose. Peterborough. We thank you. Stacy, good morning. And I just hate to miss people here. We got some new names and I like that. Terry. And our dear friend, Dr. McEwen, listening from New Liskeard. From Tennessee to New Liskeard. Raja, good morning. Okay, let's talk about pain. If you don't get our email, we actually wrote about this on our today's email. So if you get our emails, you should have got it this morning in your mailbox. We talk about pain, and I want to elaborate a little bit this morning, and based on a new study that came out. Okay, so let's talk about pain. Not that it's any fun. Pain can be very, very disabling. Okay, very disabling. Now, if you have pain anywhere in your body, anywhere, understand this. Always, no exceptions. If you have pain, you have inflammation. It's the inflammation that causes the pain. Okay? Now, there are 2 types of inflammation. We always say it. Inflammation is not Houdini, just doesn't show up. There's always a cause to inflammation. Okay? Now, your body's ability, you got an infection. Okay? Think of it. You got a cold. You have an infection. A virus has hit you. And you got a headache. You got a sore throat. You got sinus pain. Right? All of that is from inflammation that is a response to your body's ambulance system. Remember, your body has an immune system. We've forgotten that over the last couple of years. I can't handle that. Now, we haven't talked about the body's immune system. Your body's ability to fight. And we're being conditioned, okay, just got to say this, we're being conditioned not to accept a virus ever again. You got a virus, that's bad news. That's not bad news. It's not bad news. People that tell me they never get sick, when kids get sick, kids get a cold. Kids got a runny nose. It's part of their immune system. It's part of their immune system building up. It's not bad for them. It's actually good for them. But the pain part of it comes from inflammation. Now, let me give you an example. You kick me in the knee. Okay, maybe you didn't mean it, but let's say you did mean it. You kicked me. What happens? Well, I start rubbing my knee. First response of the human body, it's like reflex. You start rubbing the area of injury, right? You hurt yourself. What do? You bang your elbow, you rub it. And rubbing it helps in a way because you're bringing more blood supply. Your body's going to do it anyway. You're just accelerating the process, and your body is starting to send in the ambulance. More blood, more enzymes, more protein, all in your blood. They're all going to the site of the injury. So when you get a virus, and especially like a cold or whatever, it loves that upper respiratory area, your throat, your sinuses, your head, and the body's not stupid. It's bringing the immune system to the area of injury, the area of infection. Okay? That's all really good news. Yeah, you got inflammation. And yeah, it hurts. But you don't want to negate the response of your immune system because that is really important. Okay? It's how your body operates. Now, the problem with inflammation, okay? The problem with inflammation is if it becomes chronic inflammation. Your body's response to infection or injury, and that's all right, but you don't want it to become chronic. Now let me give you a new study that has come out of the University of Boston School of Medicine. This is hot off the press, guys. Hot off the press. And it's not good news because what they've done is that they have studied the human being's modern response to infection or injury. So what do? You got a headache. What do? You take a painkiller. Most of them are over the counter, non-steroidal anti-inflammatories, acetaminophen, ibuprofen. Okay? Naproxen, aspirin. These are non-steroidal anti-inflammatories. They sort of snip the wire so that you will have less pain. But the studies have come out. Now, we always knew this, okay? I don't know if you knew this statistic, but the reason, number one reason, people are hospitalized in North America, you know what the number one reason is? Number one, iatrogenic. You know what that means? Big word. You know what it means? People are hospitalized more than any other reason are for side effects from taking pain pills. Yep. Number one reason. They're over the counter. A lot of them, you don't even need a prescription to go get Tylenol. You don't need a prescription to get Aleve, right? You don't need a prescription to get aspirin. You don't need a prescription to get Advil, the 4 biggest sellers. You don't need a prescription for that. But the number one reason for hospitalization is not heart attacks. It's not cancer. It's the side effect of those medications. So we knew that, by the way. That's not a new statistic. I'm going to tell you what's new in a minute. Stay with me here. Okay? So what happens in these anti-inflammatories, we don't think about it. Because when we got pain, we just want to have relief. And do you think I don't understand that? Of course I understand that. But it's a double-edged sword. It's like an antibiotic. Antibiotics are great, except they kill the infection, but they kill all your good guys too. And I've done hundreds of podcasts on the side effects of antibiotics. But let's talk about anti-inflammatories today. And here's one. I'm on a little rabbit trail, so let me bring you one. Do you know there was a medication? This guy's brought steam coming out my ears. There was a medication that was brought out, Vioxx. You guys might not remember that name, but it's not all that long ago. About, I think they took it off the market about 15 years ago. They want to bring it back, by the way. It killed, listen to what I'm going to tell you. They settled in court. 50,000 people. 50,000 people died from Vioxx. 50,000 people that they admitted to. They had heart attacks from a drug. And I hate to tell you this. Pfizer paid billions of dollars in settlement. Look it up. Ooh, and no one, not one per 50,000 people died. And not one person went to jail. Okay, now that's on an anti-inflammatory, because you know what Vioxx was for? Arthritis. Pain. Anyway, let's come back. The study out of the University of Boston School of Medicine, they're looking at the effect of non-steroidal anti-inflammatories, the over-the-counter ones. You go to the grocery store, you can get this stuff. You go to your pharmacy, you don't need a prescription. And here's what they're saying, because this is new. This is new. Okay? In the long run, here's what they're saying. I'm going to quote them. In the long run, non-steroidal anti-inflammatories actually make pain worse. And here's why, they said. When you suppress your body's natural response to temporary pain, this is a major problem, okay? When you suppress the body's natural response to temporary pain. So, you've got a sore back. Okay? You twisted it. or whatever. Or you hurt your knee. Or you hurt your ankle. Or you hurt your elbow. You hurt your shoulder. Right? Well, it hurts. And I'm taking Advil, Aleve, Tylenol, aspirin. One of them. Or a combination. And you can understand it. You're sort of snipping the wire so you get less pain. But what they said, studying this, not only the major side effects of increasing your risk of heart attack, increasing your risk of liver disease. It's really hard on your liver, really hard on your kidneys, really hard on your GI, especially aspirin. Well, you know the studies. I brought this to you on these podcasts. I was one of the first guys to say it years and years and years ago. Don't take aspirin every day. What? You should have seen the blowback I got on that. I said, well, look, I understand aspirin, they're out advertising and they're telling you, an aspirin will prevent a heart attack. Maybe. But the side effects of it are worse than a heart attack, believe it or not. And hey, listen, I said it, but research has proven me right. I used to tell people, look, if you're having a heart attack, let somebody shove a bottle of aspirin down your throat. I'm not against that. But you don't want to be taking that every day. Because millions of people, my generation, and especially my parents' generation, they grew up and were weaned on aspirin. Like, man, take an aspirin. Like it was like a jelly bean. Like it was no problem. And doctors, they get, we talked about it yesterday. Cholesterol. You can't get it out of their head. Well, you couldn't get doctors because who did it to them? Bayer. Yeah, but, take a little, mild, they called it mild, 81 milligram aspirin. And they said, nah, don't do that. Research came out, and actually, even in Canada here, the College of Physicians and Surgeons, they got a little notice. Don't do that to your patients because the research is showing in the long run it's not good for you. Now, back to the study out of the University of Boston School of Medicine. They looked at this over the years, taking these over-the-counter medication. You know what they said? This is fascinating. it actually makes your pain worse. Short-term fix, long-term pain. The pain becomes more chronic because what they're saying is, if you don't allow the natural process of extra blood supply going to the area, either in infection or in injury, you're making it worse in the long run. Now, again, I didn't say that. I'm just bringing you the studies. And this is why, like for me, I've always been big on, look, I mean, you take it for a day or so, you know, like pain. Like you got pain. You just had surgery, for heaven's sakes. Okay? And you're taking medication, of course. Come on. I understand that. But the University of Boston School of Medicine has said, don't stay on that. Because it actually makes your pain in the long run worse. You're going to have more inflammation. It's going to become chronic. Yeah. And that chronic inflammation, again, your body has the ability. You got a sore joint. It sends extra blood supply, sore back, extra blood supply, but it's starting the healing process. Your body is unbelievably, fearfully and wonderfully made. And this is why, for me, in my practice, for years and years and years, I used to tell my patients, look, short term, yes, very short. And then you get to a point, you got to do this naturally with things that will build your body, not damage your cartilages or whatever. They will actually help to heal. That's why, you know, in my practice, I was big on natural anti-inflammatories. I was big on that. You look at our inflammation formula. I put that together over years of putting 8 natural anti-inflammatories in there. One of them is vitamin D. Do you know that vitamin D, Viderma, is a natural anti-inflammatory? Nature's way. Go sit in the sun. And if you can't, you take some vitamin D. Really big on it. Curcumin, ashwagandha. I like the mixture, putting things together and naturally healing. It's not as quick as taking Tylenol or whatever. I get that. I understand that. But they're showing, like I said, the number one reason of hospitalization is iatrogenic, meaning medicines that put you in there. The double-edged sword of medicine. Medicines. And the new study showing it actually now turns your pain chronic. If you snip the little wires so that you don't get pain, you are delaying healing and it'll become chronic, and in the long run, you're going to be on those pain meds forever. Now, I want to talk about chronic inflammation for a minute. How you get it? From injury. What happens from infection? Well, we know what autoimmune is, right? Those inflammation markers never get turned off. And the body is turning on itself, autoimmune, when the immune system don't turn off. And it's going after what it shouldn't go after. Immune system, you guys, your immune system is for injury and infection. Injury and infection. Knows exactly what to do. So I'm big on building the immune system. And again, vitamin D is one of the best. Vitamin D is so good because your T cells, most of your immune system is found in your lymphatic system. Most of your immune system is found in your gut. That's why I'm so big on probiotics. I'm so big on vitamin D. Because vitamin D is vitamin D, your T cells out of your lymphatic system. They got a solar panel on top of them. They're looking for the sun. They're looking for it. Their green energy is way ahead of what we're trying to do with electric cars or whatever. You know, they're looking for solar. You are, by the way, you and me are solar panels. And guess what they did? I was reading the history of sunscreens. I get a migraine. Because the sun is the boogeyman. Like cholesterol is the boogeyman. And actually what's happened is they made pain the boogeyman. Now, I look, again, in case you misunderstand what I'm saying, painkillers over the counter, or even by prescription, are meant to be very, very temporary. The rest, you do it yourself. Let your body do it. And let me give you a little bit of physiology. Like, how does this happen? Pain, how does it become chronic? Why is it destructive to joints and that? If it doesn't leave the site of injury? Couple of ways. We explain it in the emails. So again, our emails are very educational. Okay? So if you get a chance, and if you don't receive them, sign up at martinclinic.com for the emails. They'll go into your inbox. Okay? If you're not getting them, sign up for it. Okay. Enough advertising. Now, when your inflammation is high over a period of time, almost invariably, guys, this has been my experience, and this is why we wrote about it today. Almost invariably, there's a metabolic factor involved. Okay, what do you mean by that? Well, listen to this. I am a root cause guy, right? A root cause guy. When you have chronic pain, it's chronic. Your body's not healing. Well, one reason is because you were taking anti-inflammatories, non-steroidal anti-inflammatories for too long. Okay, that can be a cause. That is well established by the University of Boston Medical School. 1. 2, metabolically. Here's what I found over the years. People were metabolically unwell, and that always comes back to food. When people insist on being carboholics, a process starts in the body, they develop insulin resistance. Insulin resistance does a couple of things. 1, it creates inflammation. You already have inflammation. You have insulin resistance. You're going to have more. And when you have more inflammation, you're going to have more pain. Insulin is not your friend. Friend? It's not your friend. Insulin is your friend when it only gets secreted in a small proportion because you're eating good. But when you don't eat good, when you're eating crappy carbs, when everything now today has got sugar added to it just about, when people eat like that, they're creating a response in their body. It's called insulin resistance. Your cells are so sick of insulin, they say, get out of here. I'm sick of you. But insulin, remember this, will always do what it has to do until it doesn't work anymore. But the first part of that process is called insulin resistance. The bad neighbor coming to your house all the time. They're driving you crazy. If you're a carboholic, you've got insulin resistance. If you have insulin resistance, you're creating inflammation on top of inflammation. It will worsen your pain. Yep, it'll worsen your pain. Food will worsen your pain. Bad food will worsen your pain. Here's one of the ways it does it. When you have insulin resistance, conversion of T4 to T3, okay? Stay with me. It affects your thyroid, especially in ladies. You're not converting enough T4 to T3. You know what happens? Your thyroid slows down. You know what happens? It does not create as many chondrocytes. Your thyroid is your gas pedal. Your thyroid is the, it's the orchestra leader. Your metabolism. So insulin affects your thyroid, and your thyroid, when it slows down, is your repair slows down. Your chondrocytes, which are really important for bone and cartilage. That's one way. Insulin resistance creates inflammation, right? On top of inflammation. And you get another way. I explain this in the reset. That's why the reset's so good. A lot of people, thousands, have found out they have much less pain on the reset. Doc, why? Headaches. Better. Joint pain. Better. They don't fully understand it, but they like it. I say, yeah. Because there's a process that goes on in your body. It's called glycation. It's AGE''S. Advanced glycation end cells. Leave it to medicine to confuse you. They love using big words. But me, I'm a simple person, so I like to break that down. What's that mean? It means your joints age quicker. It means your skin ages quicker. It means your cartilage, your ligaments, your holding elements, they age quicker. That's what glycation is. And guess what glycation comes from? Sugar. Honey. Not honey, but sugar. I called you honey. Sugar. It causes glycation. Don't let anybody tell you. Don't let anybody tell you. Don't be confused. This week we're going to call it Don't Be Confused. Yesterday I gave you some real history on these fake foods like margarine and all that. Why did it come out? Yeah, cholesterol. Fake news. So here we are today talking about pain. And pain is actually the body's response to infection or injury. Because it creates inflammation. And that's all right, as long as it doesn't last. And you can use painkillers if you want, very, very temporarily. Just remember that. Very temporarily. Because the research is showing down the road, it's not good. Taking these non-steroidal anti-inflammatories, over-the-counter medication. It's not good. It actually makes pain worse in the long run. It makes pain worse in the long run because you short-circuited what your body was willing to do on its own. Give it the tools, guys. And the best way to give it tools is to eat properly. You know what's a natural anti-inflammatory? Steak. You know what's a natural anti-inflammatory? Eggs. You know what's a natural anti-inflammatory? Cheese. Good dairy. Yep. See, God gave that to us in food. Vitamin D. The sun, my friend, is good for you. Don't hide from the sun. It's an anti-inflammatory, natural, that doesn't short-circuit the healing process. Now, I hope I wasn't too much of a pain today for you. I hope we got a little bit of good teaching there. Here's the moral of the story. If you've got to take a painkiller, keep it short term. Clean up your diet. Take the right supplements for injury and chronic pain. Do it naturally as much as you possibly can. That's the takeaway today. Okay. Okay, I can breathe again. Okay, guys. Friday question and answer. Remember about the emails. Go to our website, martinclinic.com. Sign up there if you're not getting them. Look in your, somebody was telling me the other day, look in your junk file or whatever. Sometimes they get, your emails trying to protect you, right? Your service or whatever. And it can get sent into junk. And look for it there if you're wondering. Sometimes it's there. I don't know anything, but that's what I heard. Okay. Guys, we love you dearly, and we'll talk to you soon.